So individuals have been concerned that and wondering why the government is treating this swine flu outbreak differently than they usually treat seasonal influenza outbreaks. One of the main reasons is because this is a novel strain, and that means that individuals don't have immunity to this strain of influenza, and that there's also currently no vaccination available for it. And so the government is moving quickly in terms of trying to develop vaccines, as well as taking precautions using non-pharmaceutical interventions, such as recommending individuals use hand hygiene and be very cautious, especially when they're around someone who is ill, as well as potentially closing schools, for example, when there are outbreaks in schools, and social distancing. And so the government is moving quickly on this because of the fact that there's no prior immunity to this virus, and it's new and it's not yet well characterized. There has been some misinformation about the swine influenza that has been circulating, including the fact that it could be passed on by food sources, for example. We know seasonal influenza causes mortality in the U.S. among 36,000 individuals annually, and that's even with the vaccination, and 500,000 individuals worldwide. So I think it's too early at this point to make serious comparisons between this swine influenza and seasonal influenza. There are many precautions that individuals can take if they become sick or if they're living with individuals who become sick and that they are caring for. So one of the major factors in terms of the non-pharmaceutical interventions that people can do are hand hygiene. So they can be washing their hands before they start to care for a person who is ill, after they're caring for a person who is ill. They should be doing hand hygiene after they cough or sneeze. They should be covering their cough or sneeze with a tissue or coughing or sneezing into their arm. They can consider also wearing masks in the household, both themselves as well as the person who is ill, to cut down further on transmission. If they're caring for a child, for example, when they hold the child, they should take care to not hold the child's face in front of them and have it at their shoulder in case the child coughs or sneezes. There's already a lot of preparedness that has gone on within the hospital system. They have ways to isolate individuals within the hospital. I think that the medical community has prepared in that way. So the one issue that people might want to consider along with all of this information is that this is an evolving outbreak, and we're still not exactly sure about many characteristics of this virus. So there's still a lot of questions, and I think things will evolve as this outbreak continues. Some of the things that we discussed today may change, and there may be other precautions that are rolled out or developed or changed as this goes along.